Well, AF patients with valvular heart disease have historically been categorized into non-valvular AF and valvular AF. However, the patients with non-valvular AF have actually, many of those have actually had some type of valvular heart disease in clinical trials, for example, testing the NOACs in AF patients. So there was kind of like a need to a more homogeneous definition of patients with AF and valvular heart disease. Therefore, in 2017, a new definition of these AF patients with valvular heart disease, the EHRA heart valve classification system, was proposed. And after this was proposed, there's been a kind of like a need to examine, okay, these patients, according to this classification, how do they look? And we need to test or kind of like test this definition. So therefore we made our study. Well, we identified AF patients with valvular heart disease, specifically AF patients with EHRA Type 2 valvular heart disease, as this is a heterogeneous group of patients which have been less examined, and the thromboembolic and bleeding risk are less confirmed in this patient group. We used the Danish nationwide registries to identify this patient group groups by identifying AF patients when they had the first diagnosis of AF between 2000 and 2018. And after identifying this population, we examined the thromboembolic and bleeding risk in this patient group. We examined this patient group according to the absolute risk of thromboembolism and bleeding. We evaluated this patient group by describing this patient group regarding the baseline characteristics and regarding these absolute risk of bleeding and thromboembolism. Well, we found that the absolute risk in these patients, or this group of patients overall, is a heterogeneous group of patients with different types of valvular disease and severity. And also we saw that these had several different comorbidities together with their valvular heart disease. And we found that also the thromboembolic risk in these patients were different according to the valvular heart disease of thromboembolism, whereas the bleeding risk was more it was more similar between the subgroups, although we did not compare the subgroups in between, because that was not the aim of our study. But we wanted to have like, okay, these kind of patients with, for example, aortic stenosis, what are their absolute risk overall? Our study was kind of like just like a first study where we described this patient groups, but there's a need to examine whether it is the valve disease or it's the coexisting comorbidities that kind of like give this increased risk in these patients, both of thromboembolism and bleeding. And further, there's a need to examine whether the antithrombotic treatment strategy as we have it now is the best, or whether there's a more optimal way of treating these patients.